We are on number 17 right now.
Hi, I'm Heidi Siegfried. I'm the Health Policy Director at Center for Independence of the Disabled in New York. CIDNY has as its mission to help people with disabilities overcome all the barriers that society likes to put in our way, to live independently in the community and not in facilities like nursing homes. I wanted to say, first of all, I mean, it's already been addressed quite a bit, but that people with disabilities, they're more likely to be insured. They're also more likely to be using public insurance like Medicare and Medicaid. And you've heard how important the Medicaid program is to people with disabilities from nothing about us without us, from themselves. So that's why it's really important that this process be accessible to people with disabilities. I understand that the webinar last night was not accessible to people who are blind and have low vision, or to people who are deaf or are hard of hearing. So, and then also, of course, it's been referred to quite a bit that this less than 24 hours notice makes it very difficult for people with mobility impairments that need to try to reserve in advance, which are inaccessible transportation system in New York City to get here. And I'm so glad that TK is with us now. So I just did want to say that I appreciate that the governor said that his intention is not that there be no cuts to eligibility and no cuts to benefits and services. But for people with disabilities, that's not a very, well, we saw what happened with the last MRT. Much of the savings that were accrued to the state were at the expense of people with disabilities. So, for the last 8 or 9 years now, CIDNY Action Network members keep going up to Albany to try to get the 20-visit limit to physical therapy, occupational therapy, and speech therapy restored, because that was a cut. And every year I hear new stories of what kind of harm that hard 20-visit limit causes to people that need those services. The other way that the cut harmed people with disabilities is throwing all dual eligibles into managed long-term care. So these cuts then, they are not as evident as, like when Governor Pataki used to say, oh, let's cut dental, let's cut podiatry. No, it's the managed long-term care companies that effectuated the cuts. And largely, some of this, of course, might be in DME, which is continuing to be a problem, but also largely it was home care that was cut. And an example would be someone who gets 24 hours, 7 days a week of home care. They're saying, oh, you can have 4 hours in the morning and 4 hours in the afternoon. This is a person that needs to be turned every 2 hours to avoid skin breakdown and bed sores. So of course, then you're gonna have the additional cost of a wound care nurse coming in, or hospitalization, but that'll probably fall on the Medicare program now, won't it? So, but this is what we have seen, that it's only due process and the ability to request fair hearings that has protected people with disabilities from these home care cuts. So then we see, oh, let's try to cut people's access to due process. So anyway, we've seen from the last Medicaid redesign team what has happened to people with disabilities and the cuts in benefits and services that have resulted. The final thing I want to talk about is the global spending cap. Since you're allowed to address the global spending cap, I just want to say that back in 2011, I called up my friend Frank Morrow at the Fiscal Policy Institute and said, remind me of all the reasons block grants are bad. Because the global spending cap operates as a block grant. It is a very crude way of addressing curtailing growth in spending. It doesn't account for the fact that 10,000 people in this country are turning 65 every day. It doesn't account for many things. The Medicaid program, like food stamps, is supposed to be a counter-cyclical program. When we have a recession, which we do not have right now, it's supposed to pick up and help the people who need health care, who need food stamps, whatever. That's what countercyclical stuff does. So anyway, I hope that since you're allowed to revisit the global spending cap, that you will. Of course, the things that have been taken off the table also need to be addressed too, like we need to raise revenue, we need to, and hopefully the legislature will, like restoring a democratic process to these decisions, will reject these cuts and raise revenue.
Thank you.